tell us a little bit of a backstory of what happened before the judge ruling?
Sure. So our office filed a lawsuit about a week and a half ago in the U.S. District Court for the Southern District of California, demanding a drastic depopulation of the Otay Mesa Detention Center and the Imperial Regional Detention Facility, both of which confine people in ICE or immigration custody, because during this global pandemic, the population levels at both detention centers render it impossible for people to engage in, preventative measures that could prevent transmission of the virus, things like social distancing and scrupulous personal hygiene. So we filed this lawsuit about a week and a half ago, and at the same time, we filed for an emergency temporary restraining order demanding the release of all medically vulnerable individuals who are at the Otay Mesa Detention Center, where, as you know, we've seen a rapidly escalating outbreak of the virus that has now infected, I think as of today, 162 people who are detained at the facility. So we filed that lawsuit, and several things have transpired over the last week, but this morning we had a status conference with the judge because earlier this week we had a hearing during which the defendants, which hears the government as well as CoreCivic, the private prison corporation that operates Otay Mesa, they had previously reported that there were only 8 medically vulnerable people in their custody at Otay Mesa, and because of that and a number of other things, the relief we seek was not necessary. But yesterday they filed updated information stating that there are actually upwards of 50 or 60 people in that posture. And this morning we had an unexpected hearing, but it was during that hearing that the judge indicated he would be granting the request for a temporary restraining order. And we just received the order a little while ago.
Okay, what does this mean to you guys to get this judge ruling in your favor?
Yeah, so in granting the temporary restraining order, the judge declared really unequivocally that the conditions of confinement at Otay Mesa for medically vulnerable people are unconstitutional. That recognition is extraordinarily significant, and it's also significant that the order and the judge's decision today really recognizes that release is the only responsible and appropriate action here under the circumstances of the pandemic and the conditions of confinement at the detention center.
Gotcha. And what is the next step? Like, what happens now?
Yeah, so the judge ordered ICE to immediately begin reviewing, the individuals in its custody who fall into this category of medical vulnerability, and to begin releasing them immediately in ways according to release plans that comport with public health guidelines. And he set a status conference for Monday at noon, at which time the government is supposed to report back on how many people it's released and how many people remain in custody and the reasons why those people have not yet been released. So we expect this order to take effect immediately. And on our end, we'll wait, we'll vigilantly monitor compliance and also see what happens on Monday.
Gotcha. And all those people that will be released, what makes them different? Like, what makes them different from someone else? Why certain only individuals?
Yeah, so, the Centers for Disease Control and Prevention, the CDC, have put out a lot of guidance that sort of informs the changes to our daily lives, right? So according to the CDC, there are certain people, including people who are over the age, over certain ages, who are at heightened risk of serious illness or death due to COVID-19. And it includes people with asthma, with diabetes, people, who are immunocompromised, as well as people who are, I think according to the CDC, over the age of 65. That we have a class now that's been defined by the court according to similar lines. So people who according to the CDC have medical conditions that render them vulnerable, and people who are over the age of 60. The difference between them and maybe anybody else in the population is that Whereas the pandemic and COVID-19 threatens all of us. It threatens all of our, the health and safety of every single person, which is why we've seen local governments and state government and the country take these drastic measures. Whereas that's true, it's also true that people with certain underlying conditions or people of certain ages face an even greater risk of either transmission or of serious illness or death in the event of contracting the virus.
And what plan do you guys have in place for you guys for those people that will be released and they don't have anywhere to go?
Yeah, I think what happens with each individual person is going to depend on each individual person's circumstances, right? We know that detention centers like Otay Mesa confine a range of people, from people who've never been in the United States who are here seeking safety from persecution and torture, to people who are longtime community residents who have, whose families are waiting for them to return to the dinner table. And there's a lot of people in between that range. Where exactly each person goes is going to depend on those circumstances. But we know that the government is now tasked with, figuring out those appropriate release plans. And we have also, from the very beginning expressed a willingness and a desire to participate in the development and the identification of these release plans for people, who may not have them, in a way that comports with public safety, right? These are folks who are going to go someplace where they have the ability to self-quarantine if they've been exposed to the virus, and who otherwise are going to have the ability to engage in social distancing and hygiene necessary to prevent further transmission.